So hello guys, good evening. Another evening with you guys. Just I received few questions and a very crucial question, a very important question, and I thought that I should make a quick video on this one. There are a few very few very important things that I want to highlight. So the question is being asked that how should we utilize our first 2.5 minutes? Because especially I think if I've said that you can open the station in front of you throughout the throughout the station, then people might think, then what are we going to do in the first 2.5 minutes? So that those 2.5 minutes are really very crucial. Remember that when I said you can open the station in front of you, like in the 10 minutes, I didn't mean that it's okay to skip focusing in the first 2.5 minutes, because it's there in the first 2.5 minutes where you will get organized. You'll organize all your thoughts. You'll organize, you'll have that idea, that full understanding of what is it, what's it involving. And then in the 10 minutes when the station is in front of you, that's only to support you with, the fact that you don't want to miss anything. You want to, for example, I forgot name of the patient. I think I might have told you, but I've told my friends that I forgot name of one of the patients. And if you have station in front of you, that's quite an advantage, that you don't forget the BMI, you don't forget investigations, you're not missing out on them because they're in front of you. But in the first 2.5 minutes, how do we approach? Like, I was in my group where I'm teaching February students. We tried few stations yesterday actually, and we realized in almost all of the stations that candidates find it very difficult to grab hold of what actually is being asked. And it was a very a unique experience, that even those candidates who actually we thought would score a lot, and they did excellent communication and all that, but grabbing the gist of the station, that what is involved is something that you will be doing in the first 2.5 minutes. Okay, so just tell yourself that it's 2 minutes. Don't think of 2.5 minutes. I think because you have to be you could waste a few seconds here and there. So whether it's 2 minutes or 2.5 minutes, I would be personally, what I do is I think in terms of some, in terms of some maps, some bubbles. This is what I do. So when I say bubbles, like when there's a condition in front of me, when a question is in front of me, when a topic is in front of me, what I do is I divide the topic naturally. And this is how I read as well. When I go through a topic, this is how I read the topic, that I would have the concept of the topic itself, like what's the disease, what's the condition, then what's the impression, what's the impact on the pregnancy, how, if a patient becomes pregnant, how would this condition worsen or something, what can it do to the baby? So I think in terms of not in terms of lines, and not in terms of so I don't think in terms of lines of templates and all that. I think in terms of like segments, circles. This is the condition in my mind, this is the inheritance, whether it's inherited or it's not inherited, how is it transmitted, how is it, how does one develop it? So I have these kind of in circles and segments in my mind. The same thing is required in the station as well. If you have read a station in lines of the templates, you're much more likely to forget, like children do. Like, if you interrupt a child who has learned something, you interrupt them somewhere in between, it's very difficult for them to continue from that point, because once they Sorry about this. So once they miss the link, it's not easy for them to continue beyond that point. So what I mean to say is that whenever I read things, I don't tend to read from the templates. I don't tend to read like text in lines. I always imagine them in a mind map, in bubbles or in circles, and natal care on one side, medical condition one side. What are the warnings? That they come like a big red circle for me on one side. So this is how I remember. And when I'm looking at a question, this is what I'm thinking. I'm asking myself, which bubbles are being asked here? You know, effect on fertility, effect on pregnancy. Is this patient, what is this patient here for? Is she wanting to become pregnant? Has she got, is she already pregnant? So whatever effects, I just, kind of remind myself that I have to bring that box in, that circle in, that box in. So I'm kind of trying to get ready in those 2.5 minutes. What am I going to? Well, what am I going to do now? Very important part of the question is that we have noted so many times that candidates are not realizing that what actually, so what's happening? There are, you can say roughly, the question has got two kind of parts, one or two kinds of information there. One information set is about the patient. This is the patient, she suffers from this, she's this BMI, she's this BMI. And the other set of information is the purpose of the visit. She has been referred because of what reason? So that's this, those both are important, and it's not possible for you to perform if you only keep focusing on a first set of information that's about the patient. You have to definitely know what was the other segment of the information, that's the purpose of the visit. So in those 2.5 minutes, it's very important to make sense of these these elements. So for instance, I was wanting to say that I kind of think in, in circles and in shapes like this. Like here will be the condition that I'm thinking about. So I'll be thinking, there will be a segment in my head that would say, what does the condition involve? What are the systems that are affected? So as soon as there's a question coming there, I would start thinking in those terms. Then there will be something, from as soon as I start thinking the condition, the first thing that I will be thinking is inheritance, effect on fertility, any warnings there, any, effects on the pregnancy, baby condition, and how to handle these situations. And what does the antenatal care involve? What does the labor and delivery involve? Postnatal care. So different, circles, they come in my mind. So you have to also remember one thing: when you are in a station, it's a misconception to go there and just start saying things. You are taking history from the patient and you wanting to finish the history in the time that you have rehearsed, and then you want to go ahead and just fire whatever you have in your mind, all your template. But the patient does not have those questions. You have got the things in your sequence. A patient has got different questions. Sometimes patient doesn't want you to talk anything about antenatal care, or how does a pregnancy affect the condition, or vice versa. They only want, for instance, a patient could straight away say that I want you to talk about delivery. So, you don't, some people, they still don't get the idea that this patient now doesn't want me to focus on antenatal care and all that. They want me to talk about delivery and what will happen at the time of labor. So, would it be labor? Would it be elective delivery? Would it be intervention? So sometimes people, they kind of try to, they are so much into their template, their mind is preoccupied, so they don't focus that the patient is not asking those things. So this first 2.5 minutes is where you are getting that information, that what level the patient is, and what is the question asking. It's not possible to assess everything in that 2.5 minutes, because you will still be giving time and opportunity to the patient to tell you, where do you want me to go from here? Like, for instance, if it's a sickle cell disease patient, you have loads of information, you have floods of information with you. If you wanted to go on and on about this station will not, and you will never know what are you going to tell and what are you not going to tell. So in your first 2.5 minutes, you will imagine of all those, like a mind map. You will you remind yourself of all the circles that are coming with different segments in your head. But you will also first ask yourself, this is an extensive topic. I'm going to ask the patient to lead me what they want me to address, or what they want me to address first. So you are reminding yourself that this is what I'm going to do. This is very important in the first 2.5 minutes. Please remember that the more you're organized and more you have thought that this is how I'm going to attack this station, the better organized you will be, more you will be able to perform. I will always also highly recommend something that I'm used to doing, is that, if you remember from my last video that I said, please keep a glass of water next to you. So that is very useful time to just, before you start reading anything, you have a little sip of water. I'm not saying you to guys to fill your bladder and wait for the break then, but a little sip of water, wet your throat, and deep breathing, just 2 deep breaths, relax and take deep breath, and I am ready. Okay, bring it on. So be ready like that. And honestly, these 2.5 minutes, you can use the first few seconds to calm down, to relax, to deep breathe, to have a sip of water, and then comfortably with a very composed posture. You are sitting in a posture which is looking like you're a doctor, not like an exam candidate like this, and looking worried and all that. You have a decent posture, very dignified and all that, so you don't look apprehensive and all that. You can do this if you are using that first initial few seconds to have sip of water, deep breathing. So this helps control your heartbeat if you deep breathe twice. Okay, if you're nervous, if you're anxious, it controls your heartbeat, relaxes your mind, ability to focus. Remind yourself that I am going to listen to the patient. If I'm not listening to the patient, that's it, I'm done. So you have to listen to the patient, every cues them. Okay, there's information in the station, in the question, but it's the patient who will tell you that this is what I want you to address first. If you don't ask that, then she might surprise you in the end by saying that I wanted to know this and I wanted to know this. So in the first 2.5 minutes, this is your kind of job to identify elements in the question that should kind of be highlighted in your mind, that should ring some bells, that should be help you focus where you want to focus, and organize yourself so that you don't feel surprised or shocked. Then if I say, so for instance, I was giving you example that I think in terms of circles, and I study in terms of circles and boxes and shapes. I've in my mind, I have kind of, when a topic comes to my mind, it doesn't come in lines and rows, it comes like this always. And then when the patient guides, I pick up one of these boxes or circles and I try to explain things to them. Just like this is an example of sickle cell disease preconception counseling that I made for my students. So for instance, this is how I don't spoon feed my students at all. I don't tell them, I don't write lines for them to read. There's a different session where we train them how to speak, what's the opening sentences, what should they be like, how are they going to proceed, how they take permission in various ways, and how would they be ending and all that, or everything. So that I include, that is generic skills. You need to know them separately, apart from the knowledge of the content of the station. Okay. So apart from the generic skills, which I think we've used 3 sessions focusing on the at least 2.5 to focus again and again on the generic skills, and generic skills fill really 60% of your preparation if you, the OSCE specific preparation, because the content, from your part 2, and you just need to revise the green top guideline executive summaries and all that, and very very limited kind of revision there. That's a different topic. But yes, when you organize yourself in the first 2.5 minutes, this is what you did. You have a situation where there's a sickle cell disease, a patient with sickle cell disease, and she's coming for preconception counseling. You pick that up from the station. You have to please focus that is this patient already pregnant. Sometimes even that focus is, sometimes students, they can miss even this thing that she is, but she's now 6 weeks pregnant or something like that, or they haven't even mentioned whether she is pregnant yet or not, and you are, well, I hope ICOG wouldn't give a situation where they won't mention, but I'm saying mentally you should be ready that you have to read from there whether she is pregnant, whether they're saying she is pregnant or she's there for preconception counseling. That 2.5 minutes would be for that thing. Now, as soon as you started thinking this would happen, you would start thinking of, any preconception advice. What am I doing? Is this an inherited disease or not? So what I say to my students is that you have to imagine that they are asking that this patient wants to become pregnant. So if you imagine that pregnancy is point B and she is at point A, and you have to take her from point A to point B. So you know what point B is. Point B is a safe delivery with a healthy mother and a healthy baby at the end of a healthy pregnancy. So point A is what you would need to explore. Point A is her condition. You need to know the severity and all that. So this is how I'm only trying to indicate that this is how I have read and prepared. So this is how in the first 2.5 minutes, I will collect all these boxes, what are required in this station, and what, to put on the side that are not required. So I'll focus on these ones. And as soon as the patient starts talking to me, I will know that maybe, for instance, I have these boxes in front of me. Like this is what I was talking about, SCD, for instance. Then as soon as I start reading SCD, this comes to my mind. That what's the condition? What's her situation like? How severe she is? Does she have any contraindications or any reasons to delay her pregnancy? For instance, this little box reminds me that is there any iron overload, or, what's her cardiac health, and just she need medication switching, which she most likely must be. And then, very important thing, very, very important thing, which one of my students missed actually in another station, and we all had a laugh because she entered the station, she did everything very well, but she never asked the, patient or the role player that whether you already started trying for pregnancy or are you still on contraception. And this can be a big omission. Now, a good thing is that if you perform very well in rest of the ways, the way the marking sheet is made, you're not going to fail on that, because it's going to be only in a one section, maybe, you missed tiny bit of thing. But if it was only a global marking, then examiner could think that, you didn't even get the gist or the soul of the station. So, but again, if you, what happened was that if you didn't read, if you didn't focus on the station the first 2.5 minutes, this will happen. Like she wasted her next 2 to 3 minutes in, so much like anxious, that it was so evident that she didn't know where she was going and what she was doing, and she was laughing afterwards with us that yes, this was the case. So it's good that this is like a practice time, and you all can focus on these things. So please focus. 2.5 minutes are so important for you to get organized in your head that what is it that they're asking. Otherwise, now that I have told you the secret that you can keep the station in front of you throughout, but still when you're talking to the patient, you should know what you're doing. You should not be anxious. So that's why I say that the first 2.5 minutes is crucial time for you. Okay, so if I have thought in circles and boxes, this is what comes to my mind. Then that I'd be thinking stop, start, and vaccination for STD. Stop, start, and vaccination. What do I need to stop? I need to tell the patient what do I need to stop. I check with her what she's on and all that, you know. For instance, any medication that are unsafe for pregnancy, hydroxyurea, ACE inhibitors, ARBs. So we should know when something needs to be stopped. ACE inhibitors and ARBs can be stopped as soon as she finds out that she's pregnant, but hydroxyurea should be stopped 3 months before. So, but these are the nitty-gritty. I'm not going to, you know, when you remember in circles and boxes, what happens is that nitty-gritty you don't forget, because that's what we all know. We know the major segments. We forget, either we forget everything, or if we remember it. So this is because our mind also functions like in terms of, you know, bubbles and boxes, and there are clumps and clusters of information sitting together. If we forgot the cluster, we'll forget maybe a tiny cluster or a bigger cluster, we'll forget all of it. So hardly ever happens that, you know, you remembered hydroxyurea, but you didn't remember ACE inhibitor or ARBs. If when it happens that you forget what to stop, you forget everything. So in an initial organization in 2.5 minutes will help you organize in that way, that you'll remember what were you stopping, and then the next circle that comes to my mind is what am I starting. So what am I starting would be like, you know, I'd know that I will need to give her high dose folic acid. If she's a preconception patient, I'll also include in this start, you know, whether rubella vaccination is required or not required, and checking her immunity and all that. And in starting, I'll remember that she will need low-dose aspirin, and she'll need penicillin prophylaxis as per Green Top guideline, and low molecular weight heparin for her admissions. So these kind of things, and I don't give these to my students at all. I have written here in the example that these are only for examples and not for spoon feeding. So I don't fill these circles and boxes for my students. I tell them that these are there to remind them. There's no spoon feeding going on, and you don't need to, you train yourself as well in this way, that if the basic knowledge, if you know all that, you don't need to keep dragging and rote learning that into at the time of your preparation, because that will waste time. You just remember the clumps and the circles. I'll talk about this, I'll talk about this, I'll talk about this. It's easier to revise. You can name a cluster in your head and you say that, yeah, that's sorted. I know I'll talk about that. So things like that, okay? Similarly, whatever is required for her antenatal care and postnatal care and all that. And of course, these parts I say, don't worry about them, because if you know, all the times practice them with your generic skills, that you have to talk about antenatal care with consultant-led care, with MDT, joint care, and all that, and regular, you know, when she's starting the pregnancy, again you check whether that stop, start, and vaccination has been made possible or not, because she might not have had a preconception advice, and she might not have had that, you know, stopped what needed to be stopped and started with folic acid, or you know, or she might not be up to date with a vaccination. So you still find out, and whatever is required at that time, you will do it. Okay, so whatever is not, of course, suitable at that time, you won't do it. Then so this is, once you are sorted in your head that these are my possible circles or blocks that I need to talk to the patient, then you ask the patient when you go in, because it's an extensive station, you will be ready that I will ask the patient, what are your particular preferences or your expectations from today? What is it that you want me to talk about first? When you ask this, she will help you, and she'll keep helping you next, because she is impressed with your communication. She will say, she won't want you to waste your time on things that are not going to give you marks. She will direct you. So I hope these 2.5 minutes organization is going to help you. If there's any further question, please do let me know. I'll try my best to help you as soon as possible. So So let's see. I hope you can make good use of these ideas. Okay, so that's it really. Good luck with your exam. We'll soon be starting our May batch as well. So, and I have uploaded the schedule in my Telegram group. So that's it really. If you have any further questions, just let me know. Okay, bye for now. Bye bye and good luck.